the moment, PNG is looking to target its frontline workers. So it's identified 100,000 people across the country. That's made up of health workers, teachers, police, workers at quarantine facilities and at the airport. So those people you would expect to be coming in to more contact with potential COVID positive cases, but that represents only around 3% of the population. Now, PNG is hoping to get more vaccines in under the COVAX facility, in addition to the 130,000 they've already received, and Australia is also committed to providing more vaccines as well. So there will be more coming in, but in terms of vaccinating all 9 million people, aside from numbers of vaccines, you've also obviously got to consider the logistics of being able to reach people in all these remote places. So even if everyone wanted to get the vaccine, it's still going to be a couple of years before PNG would be able to achieve that.
And is there much hesitancy towards receiving the AstraZeneca vaccine? What are authorities saying about this?
Yeah, that's a big issue at the moment, Yvonne, and it's not just AstraZeneca, it's the vaccinations for COVID-19 in general, although PNG currently only has the AstraZeneca vaccine. So there was already a high level of hesitancy. Authorities have put that down to, social media and some of the information that's being shared there, some of it inaccurate. I think some of those fears have probably also, been heightened by seeing different countries, including Australia, put restrictions around who they're using AstraZeneca on. But obviously in a country like PNG, where there's widespread transmission of COVID-19, the risk-benefit analysis, you would say, is in favour of getting the vaccine. But trying to get through that hesitancy and to educate and reassure people and see what can be done to try to encourage more vaccine uptake is going to be a focus. At the moment, we're seeing a lot of hesitancy. Here in Port Moresby, only about half of the 8,000 emergency doses that Australia donated last month have been taken up. Even at Port Moresby General Hospital, about 70% of doctors have opted in, but less than 10% of nurses.
Meanwhile, the capital, Port Moresby, has been experiencing a rise in tribal violence. What's been happening here?
Yes, unfortunately, we have seen some violent clashes in the capital in the last few days. So there's been an ongoing dispute between two tribal groups, the Taris and Goilalas. This has gone over for several months, but we've seen an uptick in recent days. Initially started by quite a gruesome payback killing. Vision of that circulated online, a man being murdered in a main road. And that did lead to some clashes between the two groups. It's causing a lot of concern, obviously, for police and other authorities. The police commissioner has said that they could introduce a state of emergency in Port Moresby in response to that. In recent days, we haven't seen unrest. There were issues over the weekend, but we haven't seen any bad violence in the last couple of days, and authorities are trying to work with both groups to identify and apprehend the people involved in the killings we have seen, and to try to get community leaders to stem this violence so that we don't have to see something like a state of emergency introduced. But certainly it is still tense in that area of Port Moresby, and people are being told to avoid it for a little while longer.
Natalie Whiting in Port Moresby, thank you.